afternoon. My name is Dr. Sandhya Gelou. I am a fellowship-trained diabetologist and obesity medicine specialist practicing in Bellingham, Washington. And this afternoon, we will be discussing the topic of prediabetes. Prediabetes affects 1 in 3 adults. 86 million American adults have prediabetes, and 9 out of 10 do not know they have prediabetes. So the goal of our talk today is to identify risk factors and what you need to ask your doctor about to get screened. In 1990, 10 million Americans, or 3.6% of the population, had diabetes. By 2018, this had increased threefold. And of the 34.2 million adults with diabetes, 7.3 million, 20% are undiagnosed, and this is diabetes. Why is there this increase? Overall, Americans are getting bigger and bigger. There's been an increase in obesity, increase in higher caloric diets, sedentary lifestyle, and also an aging population. So this all contributes to the increase. Diabetes by age. Seniors, the prevalence of diabetes in Americans 65 and above is 26.8%, or 14 million. In youth, this number is also increasing. Although it is small, the occurrence of type 2 diabetes in the ages 10 to 19 years old has increased 95% from 2001 to 2017. The trends are increasing in both type 1 and type 2 diabetes among youth under the age of 20. So both are increasing. We're not sure why type 1 is increasing. There is some thought that our exposures to more viruses might be triggering this autoimmune response. Type 2 is most likely increasing due to our increasing weight. Prevalence by ethnicity and race. So this is also an important thing to consider. Your ethnicity and race can predispose you to having prediabetes or diabetes. There's an increase, 14.7% in American Indians and Alaska Natives, followed by Hispanics, followed by non-Hispanic Blacks, followed by Asian Americans, then followed by non-Hispanic whites at the lowest risk factor. So what blood tests can you ask your doctor about to be diagnosed or to see where you are on the spectrum? So the first test is called a fasting plasma glucose. So that's a finger stick test where you check your blood sugar in the office or at home. And it's a snapshot of what your blood sugar is doing in that moment. Now, fasting is over an 8-hour fast, meaning nothing to eat or drink for 8 hours. If that number is over 126, you have a high chance of having diabetes. If that number is over 100, that puts you in the prediabetes range. So then you would need another test, which is that middle test, the next test on your hemoglobin A1C, to confirm whether you have diabetes or prediabetes. Now, a hemoglobin A1C test is different in that it can check your blood sugar for 3 months to see what your blood sugar has been doing. That average blood sugar equates to a number, and those cutoffs are different for the A1C. So if that number is over 6.5, that's the diabetes range. If that number is 5.7 and above, that puts you in a pre-diabetes range. And the reason this can do a 3-month check is it checks the amount of blood sugar that is attached to your red blood cells. And red blood cells recycle every 3 months. That's the lifespan of red blood cells. So if you measure how much is attached to it, then you can get an average. And the last test is an oral glucose tolerance test. This is similar to the test that pregnant women take, in which you ingest a glucose load and then your blood sugar is checked. This one is a little bit less common. The other two are, the first two are easier to obtain in your doctor's office. And the cutoffs for that one is over 200 for diabetes and over 140 for prediabetes after ingesting a glucose load. So what are the types of diabetes? So type 1 diabetes is an autoimmune destruction of the B cells in your pancreas. And what happens is the B cells in your pancreas create insulin. So if those cells are destroyed, then you don't produce insulin. In type 2 diabetes, that is twofold. So you have a defect in your insulin production, so the beta cells are not making enough insulin, but also your body is insulin resistant. So the insulin that your body is creating, your body is not detecting that insulin is there. So that one's twofold. Gestational diabetes is specific to a type of diabetes in pregnancy. And that happens due to the increased hormone surges, growth hormone, other hormones that a woman's body is exposed to. And so that can push some women into the diabetes range. There are other specific types of diabetes. Monogenic syndromes are one of them, which is like a genetic type. There are diseases of your pancreas, such as pancreatitis, cystic fibrosis, pancreatic cancer. Those can all mess up your insulin production by destroying your beta cells. And there are also drugs or chemically induced diabetes, which are your exposure to prednisone or immunosuppressive medications. And usually it takes your risk for diabetes increases the more you expose yourself to prednisone. So if you have an autoimmune disease where you're taking prednisone, or if you're getting repeated joint injections in your knees or your shoulders, in theory, that steroid is supposed to stay in that joint, but that can also increase your risk of diabetes. And if you have any type of pulmonary diseases such as COPD or asthma, you might be on repeated doses of steroids. So these are all things to consider that you may be at increased risk due to that. So why do we worry about diabetes? Basically, it affects both your microvascular and macrovascular structures. So your microvascular structures are the small vessels in your body. So it affects your eyes, your kidneys, and your nerves. So those are the most susceptible organs initially when you have diabetes. And then eventually can also affect on a macrovascular level. So increasing your risk for heart attack, stroke, peripheral vascular disease, which can then lead to amputations. So this is the reason why we care about our blood sugars. COVID and diabetes. So this is, a lot of data is just coming out now, and we believe that there is an increased risk of developing diabetes or prediabetes after exposure to COVID. We're unsure if the virus directly affects the beta cells in the pancreas, or if it's just the overall inflammation that contributes to insulin resistance, or if the receptors in the lungs may be similar to the receptors in the pancreas. This is still up for debate, but some preliminary studies are showing that there may be an increased risk of having blood sugar problems if you've ever had a COVID infection. So if you've had a COVID infection in a year or so, I would definitely recommend that you speak to your doctor about finding out the status of your blood sugars. Diabetes in your kidneys. So this is another huge part of diabetes in that it affects your kidneys. And oftentimes we don't know how your kidneys are affected until it's too late. So diabetes is the leading cause of chronic kidney disease. The prevalence of end-stage renal disease, meaning people that require dialysis, is 10 times higher in patients with diabetes. 80% of the cases of people that end up needing dialysis are a combination of diabetes, hypertension, or both. So how can you find out if you have prediabetes or diabetes? How can you find out the status of your kidneys, how your kidneys are doing? So yearly, a test can be done in your urine, which is a screening for albumin or a microalbumin test. And basically, microalbumin is a type of protein that's in your body. And if it's detected in the urine, that means that your kidney is not doing a good job filtering those out. And that is a red flag that, hey, we need to control our blood sugars better. We need to get our blood pressure under control. So having a yearly screening of your albumin in your urine is very, very important. Weight. So having an increased weight increases your risk for diabetes. So the categories where we start worrying are this yellow category, orange, red. So overweight, obese, and extremely obese. So how can we find out where we're at? By calculating a BMI that can tell us where we fall in these categories. So BMI calculator is really easy. You can Google it. It's on the CDC website. You can Google BMI calculator, CDC, and the way that it's calculated is your weight over your height, meters squared. So kilograms over meters squared. And you don't have to do the math. You can just plug your numbers in feet and pounds. So how are we doing in general as clinicians in helping patients meet our goals? So not that well. So 33 to 49% of patients still do not meet blood sugar goals, which is your A1C, blood pressure goals, or lipid goals. Only 14% meet all these targets, and including a non-smoking status, because smoking is very dangerous to, well, it increases your blood sugars, but it's also very dangerous to your micro and vascular vessels in your body. So your microvascular and macrovascular structure. So what we were talking about, your eyes, your nerves, your brain, your heart, your peripheral vessels. And the reason this happens is we have barriers in healthcare. So we see different providers, the medications oftentimes are difficulty in getting covered. So there are a lot of different reasons we do not meet our metrics, but a way we can improve this is really starting by you, the patient, coming to the doctor and asking about the things that matter to you. And then that way we can come up with a plan together. What is prediabetes? So what about prediabetes? As of 2018, 88 million Americans ages 18 and older have prediabetes, and only 1 in 10 know. That means every 1 in 3 of us are at risk for developing prediabetes. So what is prediabetes? Prediabetes is a chance for us to make a change. So I like to think of prediabetes as prevent diabetes. Our body is telling us that we're starting to creep up in our blood sugars, that things are starting to get a little bit out of whack. And it is an opportunity for us to change some lifestyle habits and do things that will help prevent diabetes. What is prediabetes? It's a blood sugar elevation above normal, but not quite high enough for the cutoff to be diabetes. Prediabetes is not benign. I think in the past, most clinicians would say it would be, oh, it's okay, you're not at diabetes yet, just keep an eye on what you eat. But now we know that damage does occur at this prediabetes level on your microvascular and macrovascular. So it does affect your vessels and your heart, even at these low excursions of blood sugar. So it's not benign, and this is an opportunity for us to make changes. If left unchecked, a majority will develop type 2 diabetes within 5 years. Prediabetes contributes to later complications of diabetes, so it's a precursor. So I would like for you to think of it as an opportunity to make some changes. And the sooner you know, so the sooner you get your blood sugar tested, your A1C tested, talking to your doctor about what your blood sugars are, we can make some changes if needed. So knowing is half the battle. So like we said, 1 in 3 of us have prediabetes, and 9 out of 10 do not know that we have it. So who's at risk, and how can we prevent our risks and reduce our risks? Anyone over the age of 45, being overweight, having a sibling or a parent with diabetes, having high blood pressure, not physically active, or ever having gestational diabetes, all puts you at risk. How can you reduce your risk? Stop smoking, moving more, keeping a healthy weight, and adding healthy foods into your diet. So the main crux is weight loss. So let's take the test. The CDC and the ADA have come together to make the prediabetes risk factor test. So let's go through and take it together. So if you have time, just grab a piece of paper and something to write with, and we can score it ourselves. So how old are you? 40, is 0 points. Between 40 and 49 is 1 point. 50 and 59 is 2 points. 60 and above, 3 points. Man or woman, you get 1 point for man, 0 points for women. For this next question here, have you ever had, if you were a woman, have you ever been diagnosed with gestational diabetes? That's 1 point, 0. So men don't do this question. Question number 4 is, do you have a mother, father, sister, or brother with diabetes? Number 5, and 1 point for yes. Have you ever been diagnosed with high blood pressure? 1 point for that. Are you physically active? Now, what is the definition of physically active? Definition of physically active is at least 30 minutes of physical activity a day. And that is something where you are working up a sweat. And then your weight category. So based on your height and weight here, you can go through and score yourself 1 point, 2 points, or 3 points. And if you are below these weight cutoffs, you don't get any points for them. Okay, so if your score is 5 or higher, you are at an increased risk of developing pre-diabetes, and it's very, very important that you speak to your doctor about this and do one of those blood tests that can help see where you are at. If you are of the ethnicities of African American, Hispanic Latino, American Indian, Alaskan Native, Asian American, Pacific Islander, you are at even higher risk. Even if your score is 5, you're at an even higher risk. So these were the tests that we spoke about briefly in the beginning. So just a quick recap, if you have an A1C test, the cutoff for prediabetes is between 5.7 to 6.4, and for diabetes, it's 6.5 and above. If you have a fasting blood sugar test, it is 126 for diabetes and between 100 and 125 for prediabetes. If you're taking a glucose tolerance test, which is that one where I say you take a glucose load, and then check your blood sugar after at a given time period. Diabetes over 200, prediabetes between 140 and 199. The first 2 tests are more easily accessible to you, the A1C test and the fasting blood sugar test. So what are the current screening recommendations? So prediabetes screening with the CDC questionnaire should be considered with all asymptomatic adults. So if you're scoring a 5 or above, you're bringing that to your doctor and you're saying, hey, I need to check my blood sugars. Testing should begin for everyone at the age of 45. So if you've never checked your blood sugar before and you're over the age of 45, you should, even if you have no risk factors. And you should continue to do that at least every 3 years. If you're overweight or obese, testing should start at the age of 35. And we should consider testing in lower BMIs if asymptomatic adults of any age with a BMI over 25, but if a lower BMI of 23 in Asian Americans who have 1 or more additional risk factors. So if you have any risk factor and your BMI is right at that 25 cutoff or 23 for Asian Americans, you should be screened. And we talked about the tests that can be used for screening, those 3 tests. So fasting blood glucose and A1C, or 2-hour oral glucose tolerance test. Overweight or obese children and adolescents with 2 or more diabetes risk factors should be tested for prediabetes. So any family history, being overweight or obese, you should be asking your doctor for a test. So what can you do? So if you have prediabetes, we have programs, one being called the Diabetes Prevention Program. Anyone with prediabetes can join this program. And you can see the results here. So basically it shows that lifestyle modifications with a similar type of program, like the Diabetes Prevention Program, works even better than medication, such as metformin. And metformin is a diabetes medication that can also be used off-label for prediabetes. And placebo is that blue line there. So here you really see green that lifestyle line is the way to go and the more effective way. So what are the goal of these programs? So the goal of these diabetes prevention programs is to prevent diabetes or delay the onset, reverse prediabetes, which is quite possible when you're in that prediabetes range, preserving your beta cell function. So as you lose weight and become more healthy, your insulin function increases and you don't burn out your pancreas as quickly, and you can preserve the insulin that's being made from your pancreas. Preventing or delaying microvascular, cardiovascular complications, and ultimately reducing the impact of diabetes on individuals and families and our society as a whole. 58% of new cases of type 2 diabetes can be prevented through programs like the DPP program, which is offered through the YMCA as one of them. So pre-diabetes and cardiac health. So in the past, like I was saying, prediabetes was not really considered a problem. It was just kind of like, well, keep an eye on things. You don't have diabetes yet. But now we know that prediabetes itself can significantly boost someone's chance of having a major cardiovascular event, even if they never get to having diabetes. And based on the data of the American College of Cardiology, that is very, very significant. And having prediabetes nearly double the chance of a major adverse cardiovascular effect. So for heart health, even pre-diabetes alone is dangerous. So what can you do? So weight loss is really the crux of the treatment for prediabetes. If you can lose at least 7% of your total body weight, that can push you out of the prediabetes range. The other thing is ask your doctor about weight loss medications. There are many medications now on the market now that are used to help patients lose weight and are safe, and a lot of them are in the diabetes realm. One popular one is a GLP-1 agonist, so that's an injectable. Usually these help you lose weight, and they keep you full longer and help your body make its own endogenous insulin. So I would ask your doctor about that class. Metformin is always a great class. It's used off-label for prediabetes, but on-label for diabetes. It tells your liver to not make as much blood sugar, not to pump out as much sugar. And your SGLT2 inhibitors are also a class of diabetes medications that can help with weight loss. The way that medication works is you pee out the extra sugar through your urine, and you can pee out almost 250 to 300 calories through that also. And that one helps your blood pressures too. It has a diuretic effect. And how can you decrease your insulin resistance? So prediabetes and diabetes are that combination of low insulin production as well as increased insulin resistance. So exercising alone, even without having a significant amount of weight loss, even exercising 30 to 45 minutes a day decreases your insulin resistance. Reducing your carbs overall help decrease your insulin resistance in terms of not exposing your body so much carbs, so much blood sugar, so much sugar really. Treating your cholesterol, and especially treating any high triglycerides. Triglycerides are also directly toxic to the pancreas, so controlling that would really be helpful also in reducing those types of fatty foods, and also treating your cholesterol, preferably through a sort of like a statin medication would be really helpful overall. And a healthy diet, so eating more leafy greens like romaine, kale, spinach, collards, increasing your lean proteins, filling up with fiber, trying to drink more water, avoiding sodas and sugary juices, completely cutting those out of your diet, experimenting with lower carb grains that have more fiber and protein, such as quinoa, oats, bulgur, Ezekiel bread, indulging in healthy fats such as nuts, seeds, avocados, dark chocolate, fatty fish. Cutting back on salt, paying attention to your portion sizes. When you can always use the plate method. So the plate method is half your plate you want to have with greens, a quarter starches, a quarter lean protein. If you go out to eat, Don't bring home leftovers, or as soon as you go out to eat and get your plate of food, I recommend, bringing Tupperware and immediately taking half of that portion size away to either use at a meal for the next day or the day after that, but really not finishing that full portion size. And if you do bring home leftovers, just make sure that they are serving a full meal for your next day. So either a lunch or a dinner. And overall, trying to reduce your intake of carbs and sugars. So enrolling in a diabetes prevention program. So if you are diagnosed with prediabetes, or if you are overweight and obese and have a sedentary lifestyle, you will most likely qualify for these programs. One is run by the Whatcom Family YMCA. That's the information for Tara Marshall. And another one is through Washington State University. Kate Foster runs that one. And I believe she has another group that's getting ready to go in September of 2022. If you would like to do a diabetes prevention program virtually, Noom.com does one. It's totally virtual. You just have to go through the quiz. And even if you don't have prediabetes yet, if you are overweight or obese and lead a sedentary lifestyle, you will qualify. There's a discount code on there you can use called Noom Healthcare 30 for 30% off. So I would recommend looking into that program too if you prefer to do virtual. So in summary, prediabetes affects 1 in 3 U.S. adults. A benign sounding disease, but prediabetes significantly contributes to the serious complications of diabetes. And even before you get to diabetes, you can start getting complications. Take the prediabetes test on the CDC website, the one we went through today, and talk to your healthcare provider. Talk to your healthcare provider about your A1C and your BMI. See where you stand. See what your average 3-month blood sugar is by getting a hemoglobin A1C test of the blood test, and calculate your BMI online. See where you are. Are you a normal weight, overweight, obese? See where you are. Prediabetes is a rare opportunity to reverse the disease of diabetes without using medication and really preventing a disease. So we don't have a lot of opportunities in healthcare really to prevent a disease. It's usually you are diagnosed with the disease and then you try to treat it for the rest of your life. But prediabetes is a rare opportunity to prevent diabetes. And if you have prediabetes, please enroll in a diabetes prevention program. Thank you for your time today. And my contact information will be in the details on the bottom of the video. And if you have any questions, feel free to reach out. Thanks.